Okay, in this short video I'm going to demonstrate strokes on the back of the thigh and the calf muscles. These strokes are briefly outlined in the handout on E-Class that describes the massage strokes and various examples of variations. So to start with, again, we will apply a little bit of oil, and to prepare for effleurage and stroking, our first stroke, we'll get the oil applied to the hands, and we'll start with an upward stroke on the limb, getting the oil spread around and also getting our patient used to our touch. So this is effleurage. Generally, effleurage has a bit of mild pressure moving up towards the top of the limb and then gentle pressure on the way back. Stroking is very similar, but you might use it repetitively in an area. Hand over hand, one hand following the other. You can use supported hands as well, which is what I'm showing here. You want to make sure your hands are relatively relaxed so that they're following the contours of the body part. And you want to apply that bit of pressure up and then lighter pressure on the way back. So that's some examples of effleurage and stroking. The next category of strokes we'll talk about and look at is petrissage, which includes sort of kneading and compressions as our first grouping. And so kneading, I'm going to show first of all, is palmar kneading. So again, my hand is following the contours of the body, and I'm working in a circular motion. I apply a pressure on the upward part of the circle, let go of the pressure, and lighten the hand as you bring it back down to sort of the lower part of the circle. So I'm showing here palmar kneading using one hand on the back of the thigh. Now I'll show palmar kneading using both, where I'm just going to alternate hands, and I'm going fairly slowly here just to show that. We'll go down to the calf now, and I'll show thumb kneading. Again, pressure on the upstroke, lighten it on the down, pressure up. Now I'll show those in tandem. And I'll speed this up just a little bit so you can see the variations on how the strokes are applied. So that would be thumb kneading. A little bit of effleurage on the way down. You can also use kneading using your fingertips. Again, circular motions on the way up. A little bit more pressure on the way up, and release the pressure on the way down. Compressions are a little bit different. There is no circular motion. You're just going to press in and release. Press in and release. Come back down. Here I'm showing palmar pressure, following the hamstrings up on the back of the thigh. Here I'm showing some fingertip pressure. Have to be careful on the hamstrings. They can be an area that are quite sensitive to patients, so I'm just showing fairly light compressions here, following a line along the hamstrings. All right, let's move on now to picking up, which is another type of petrissage stroke. This one I'm going to demonstrate open C's. So I'm using my hand to sort of just do like a mouth or a C type of motion. I'm picking up, squeezing in, picking up. I'm doing the adductors here, a little bit on the hamstrings, and a little bit more lateral hamstrings here. And again, just a bit of effleurage up towards the body. Another version of picking up with the back of the leg is very nice, is using two hands. So I'm doing a squeezing motion and then lifting. Squeeze and lift. Alright, the next petrissage stroke is ringing, and this is where you're going to go back and forth over the tissues. And it's kind of like wringing out a cloth. A little bit of pressure, moving the tissues back and forth. And my patient clearly has had enough of that one. Rolling is another technique we'll do in just a moment, but I'm going to show you tracking and muscle stripping on here to begin with. So tracking, you're going to put a bit of pressure into the tissues, and you're going to very, very slowly follow the track that the muscle and the tissues allow you to do. So this one is a very slow movement because we're really kind of letting things relax and soften in front of the hand. Here I'm using the fingers. You could easily use the thumb or a reinforced thumb, and you certainly can do it with a palm or the whole hand as well. So that's a little bit of tracking. You're trying to follow what the tissues will let you do at that moment. Stripping I won't show on the hamstrings because I know my patient will not respond well to that at the moment, so I'll go down to calf. For stripping, you're going to move similarly through tracking, but now you're not really waiting for the tissues to respond in front of you. You are more sort of passing along and through them, which is a lot more intense for patients, so you have to really kind of watch how their body is responding. If you notice toes curling under or that kind of thing, you know you're probably going too quickly. And there's definitely some line of tightness here. Alright, so that's sort of the difference between tracking and stripping. And the last petrissage technique is skin rolling. And what I'm doing is just taking the lotion off. For rolling, you kind of need the surface to be fairly tacky, or let's say not oily. So we needed to get a little bit of that off of there. For skin rolling and rolling, you're going to pick up the tissues between the thumbs and the two fingers. You're going to do a little bit of a lift, not a tight squeeze, but a little bit of a lift, and then you're going to push the thumbs forward and walk or move the fingers forward. Again, a fairly intense petrissage type of stroke. You have to do it with good care and attention for your patient. So that's a little example of skin rolling there. The third massage stroke is frictions, and you will cover frictions a little bit more in your first mobilizing course. So I'll just briefly mention here that for frictions, we want to not just move the skin, but you want to get down to the tissues below and move the deeper tissues. So for example, if we were going to friction the Achilles tendon, you don't want to just stay on the surface of the skin. You want to be able to press down into the tissue where the tendon is, and then either do cross frictions, which would be literally across the line of the tendon. In this case, the tendon is vertical, and we would be going across it at different angles. A lot of times you'll put those structures on a stretch, to cross friction them, and so that would be transverse. And then you can also do more of a circular friction, which again would be getting into the depth of the tissue and then moving in a circular manner. So that's a deeper pressure as opposed to just moving across the skin. So that'll be covered a little bit more in your mobilizing course. The last category of massage strokes are your percussion or your tapotement strokes. A lot of times it's nice if you put a towel for some patients that are sensitive, like the one I have here tonight. So I'm going to put a towel over to demonstrate most of these because they are quite stimulating and can be quite sharp. So the first one I'm going to show you is what's referred to as clapping. And what's good to keep in mind with this is you guys are learning this or will be learning this in your percussions for chest physio. So it's a loose palm. You've created a little bit of a concave surface here, and you're going to be dropping the wrists down onto the areas that you're doing clapping on. Generally, we don't do percussion over bony areas in the sense of directly on bones, like kneecaps and ankle bones and such whatnot, but it certainly is a good stroke to use on more of the muscular areas for purposes of massage anyways. Hacking is the next one. In hacking, you're going to have the movement come just from the forearms. So it's like a pronation, supination. Your elbows are held out to the side, and you're basically hitting the surface of the body with the parts of these fingers here. It can be quite an intense feeling for your patient, so you don't want to stay in any one spot for too long, but it is quite a nice stimulating stroke to use. All right. The next two are loose fists. and you're going to have palms down to do beating. And turn the hands sideways again, just like hacking, and you're going to have the fist loose again, and this is what's referred to as pounding. The last two strokes we have under percussion is your shaking. So this is a stroke where you're just going to give the muscles a jostle or a shake. This is used quite a bit in sport massage applications. Again, all these Tepotement types are used for that very well. So that's more of a shaking. You can also rock the limb, use a rhythmic rocking, which is kind of a nice way to end some of the more stimulating movements you might be doing. And then the last one that you can make use of is the whole limb shaking, where you just sort of give a little bit of traction to the limb in this case and shake the whole limb. And I think that covers all the 4 categories of massage strokes.